Hello, my name is Birgit Neuhuber. I'm a scientific review officer at NINDS, and I run one of the 3 study sections that review translational applications, including those in response to the CREATE funding announcements. CREATE applicants often wonder how their applications are being reviewed. So in this short presentation, I will summarize the key aspects that we ask our translational panels to evaluate. In general, we ask our reviewers to address 4 key questions. Is the project worth doing? Are the applicants ready to go? Will the proposed work be done well? And will the project achieve the desired end goal? Let's just go through these questions one by one, starting with, is the project worth doing? Here reviewers are asked to evaluate the rationale underlying the study, as well as the data supporting this rationale. In this context, they will assess if the choice of target and therapeutic makes sense with regard to the disease, as well as the proposed target product profile, the TPP. You can find examples for well-developed TPPs on the NINDS website. Reviewers will also evaluate if the proposed therapeutic is likely to affect clinical practice, considering existing treatments, as well as other therapeutic development efforts currently underway. Finally, since translational projects at this stage are supposed to rest on a solid foundation of supporting data, reviewers are instructed to critically assess the robustness of the key data following NINDS rigor guidelines, a link to which is provided on the slide. In brief, to evaluate these key supporting studies, which should be described in the application, reviewers will look for the use of appropriate controls and statistical analyses, the presence of adequate sample sizes and associated power analyses, as well as measures of randomization and blinding. It is of course possible that supporting data from previous studies do not fulfill all rigor criteria. In this case, reviewers are instructed to take into account if weaknesses in the supporting data are acknowledged and adequately addressed in the approach of the proposed studies. The next question is if applicants are in fact ready to go. In other words, does the proposed project fulfill the entry criteria for the respective CREATE tract? For CREATE discovery, this includes the clear and convincing demonstration of proof of concept, the presence of one or more sufficiently profiled therapeutic leads, and the availability and suitability of in vitro and in vivo assays required for lead optimization. For CREATE development, ready to go means having a fully characterized final candidate with known minimal and optimal effective dose. The timing and duration of treatment also need to be determined. And finally, there has to be evidence for the reproducible production of the candidate. If entry criteria are not fulfilled, a project may be deemed premature for the respective CREATE tract. And the link on this page will show you a much more detailed comparison of entry criteria for both CREATE tracts. The next obvious question is if the proposed work will be done well. There are a few aspects reviewers are asked to evaluate with regard to this question. First and foremost, reviewers will evaluate if the proposed experiments are rigorously designed, again following NINDS rigor guidelines, summarized in the link on the bottom of the slide. Just as for supporting data, rigorous design includes the use of appropriate controls, the presence of power analyses and associated assumptions for sample size estimation, clear statistical plans for data analysis and interpretation, including data handling rules for inclusion, exclusion, or missing data, as well as measures of randomization and blinding. In addition, reviewers will assess if proposed assays, models, and endpoints are consistent with the proposed TPP. Second are the milestones. Since milestones are used to determine continuation of funding at the annual review of non-competing applications, which is done by program staff, reviewers are asked to carefully evaluate if proposed milestones are sufficiently quantifiable, robust, and detailed enough to allow for these critical go-no-go decisions. Examples for well-designed milestones can be found on the link at the bottom of the slide. Weak milestones that do not allow for clear go-no-go decisions obviously will affect the overall impact of the proposal. We also ask reviewers to identify if important milestones are missing and should be incorporated, or if existing milestones should be modified to further strengthen the approach. However, in either case, reviewers are instructed to score the application as is, even if modified or added milestones would substantially improve their enthusiasm. Reviewer suggestions and their potential impact on the score will be noted, though, in the summary statement. Lastly, reviewers are asked to assess if a multidisciplinary team repressing all required expertise has been assembled. The absence of essential expertise, and this could be, among many others, a dedicated statistician, a CMC expert, or a clinical trialist, will negatively impact the evaluation of the proposal. Ultimately, reviewers are tasked to assess if the proposed studies will move the therapeutic forward along the translational path and toward the respective end goal. In the case of Create Discovery, this means that the project should lead to a well-characterized candidate with known minimal and optimal effective dose, PK-PD relationship, known time and duration of treatment, and evidence of feasibility for production. Essentially a therapeutic that is ready to go into the Create development phase or a similar program. In the case of Create development, achieving the desired goal means to complete IND-enabling studies and submit an IND application to the FDA, or optionally even perform an early clinical trial. Reviewers will be asked to identify potential roadblocks in this translational path. Roadblocks include the absence of letters of support from critical collaborators or consultants, or any potential issues regarding intellectual property. IP is a review consideration, so potential issues will not affect the score unless the lack of critical information in the IP section actually affects the feasibility of the proposed work. I hope this short summary was helpful for you. If you have any questions with regard to the Create review process, you can contact me at the email provided on the slide. For program questions, please contact Dr. Hao Wang, and thank you for your attention.